What's one of the most important pieces of survival equipment that you can carry? An individual first aid kit, or more commonly known as an Ifak. Stick around, we're going to discuss the ingredients. Ollie from Sierra Outdoor Survival. Let's go ahead and get into this Ifak and see what we've got here. All right, when we're discussing an Ifak, we're going to utilize the MARCH protocols. MARCH stands for massive bleeding, airway, respirations, circulations, hypothermia, and or head injuries. So the first thing we'll deal with is massive bleeding. Now, massive bleeding is anything that would soak the clothing, create a large pool of blood, perhaps it's spurting. This is a life-threatening blood loss. This is something that if it's not tended to immediately could end in death. There's a couple different things we can utilize for this. Initially, we want to start with trying to pack the wound. This could be from a stab wound, a puncture wound, something of that nature. So you want to get some Z-folded gauze. You want to punch it down really tight into that wound. Try and find the actual source of the bleeding and stop that bleeding. Another thing you could utilize is compression bandage. This will also help compress that wound and hopefully stop the bleeding. Now, if all else fails, there's always a tourniquet. And we can apply this tourniquet in a proper protocol manner. Next thing we'll go to is the airway. Now, we want to make sure that that airway remains open. You may need to utilize CPR in this manner, but there's a couple tools that we can utilize. One of them being a nasal airway. This is something that you would insert into the nose. This would help open the airway and keep that airway flowing so the person can breathe. Another thing we want to look for at this point is any kind of chest wounds. If there's any kind of open chest wounds or what we commonly refer to as a sucking chest wound, a chest seal is a very good thing to carry around. This is something that will seal up that wound and prevent the lung from collapsing. The next thing we're going to talk about is respirations. Now, you want to monitor the victim, the patient, for how they're breathing. We want to make sure that their breathing is at a normal rate. Once we've done that, now we're looking at circulation. Circulation, we want to make sure that proper blood flow, things of that nature. We've maybe dealt with a blood loss. We want to make sure that they're not showing any signs of shock. We want to keep them comfortable and warm. That moves us into hypothermia. Now, in hypothermia, obviously, you're going to have a loss of body temperature. We want to make sure that we prevent that. One of the ways we can do that is with an emergency blanket. I'd recommend if you have a victim who's had a serious injury, go ahead and wrap them up until you can get EMS there to take over. Finally, we have some extra items, and these are just items that are good to have. A good pair of bandage scissors is always a good thing to have. Maybe a pen light so you can check pupil dilation. This would alert you to possible head injuries and things of that nature. Also, don't forget PPE. Something to clean your hands with, and gloves are always a good idea. Those are the basic ingredients of an Ifak. You can always customize an Ifak to suit your needs, and especially when you're out in the woods with your family or your loved ones, you may need individual items that suit each of those people. Customize that fits your needs. So I hope this gives you a basic understanding. As always, you can go to our website, sierraoutdoorsurvival.com, sign up for one of our classes to learn more, and maybe learn more about how to utilize some of this equipment.